This video discusses consent and patient-reported outcome scores for patients in the bone and joint infection registry. Patients' data can be uploaded onto BAJIR without their consent, as covered by Section 251 and your trust's Caldicott Guardian. As soon as a patient has a confirmed infection, their record will be accessible by the administration team for BAJIR, and we will contact patients at 6 months, 1 year, and 18 months, both to confirm their consent for their information to remain upon the registry, and for us to collect their patient-reported outcome scores at these time points. So, for a clinician in a trust, it is appropriate to upload the patient's details onto the registry without their consent. That's covered. What we do ask is that you provide baseline patient-reported outcome scores for that patient. Now, baseline could be when they are first referred to your trust. It could be they could be obtained on the morning of their first surgery for infection, but please just try to obtain those scores as early as you can when you're aware that that patient may have an infection. The way to record the patient's outcome scores are to add a date for follow-up, add a follow-up period, so on this date, they've recorded their scores, so we hope that the patient's alive and that the PROMs are complete. We have no systemic complications. If we go through to the next page, this allows us to update their EQ5D 3L, which is the score that we are using in BAJIR. And once they're selected, that will update to a score of 0.516. And we go through to the VAS scale of patient's health on the at their baseline, which we can include there, and save and exit. So that patient now has PROM scores present upon the registry at baseline, and you need to do no further PROMs for that patient. That process will be performed by the admin team in BAJIR at 6, 12, 18 months and going forward, and we will also obtain their consent. Thank you very much.